everybody. Thank you for joining me for this webinar today. I'm Dr. Sarv Varta Khalsa, and I'm going to be talking about allergies today. I'm up to be the webinar presenter. We kind of rotate through all the docs here at Living Wellness Medical Center, rotate through who does the webinar each month, and it's my turn, and I thought it would be appropriate to talk about allergies since we are in the middle of allergy season currently. So let's jump right in. Just a couple notes before we get started. If you have questions through the presentation today, just jot them down, and then let's save questions to the end. I'd be happy to answer any questions that you have. So let's go ahead and dive right in. So today I'm going to be talking about testing options for allergies as well as natural treatments for allergies. I'll also be touching on conventional treatments as well, but mostly focusing on natural treatments since that is our specialty as naturopathic physicians. All right. So allergies are very common. And according to data from the CDC's National Center for Health Statistics, in 2021, nearly 1 in 3 adults and 1 in 4 children in the United States reported having seasonal allergies or eczema or food allergies. So as you can see, this is very, very common. The most common months are February through June. These are the worst months for allergies in Arizona. It varies a little bit, from state to state, but those are the peak months for, Arizona. And so during this time, even people that don't have allergies normally, can all of a sudden start having symptoms of allergies. And so kind of classic allergies symptoms would be, we call it hay fever, would be things like nasal congestion and runny nose, sneezing, itchy eyes or nose, itchy throat. These are all sort of those histamine type responses that we get when we have allergies, and it can be pretty uncomfortable. And then some people have allergies, unfortunately, all year round, and they might worsen around allergy season, but they just have them all the time. So I'll be discussing some testing options to evaluate allergies and trying to figure out kind of maybe what some of the causes are for each individual. And then I'll also review some treatment options for allergies. Like I said, I'll touch on conventional, but I'm going to primarily focus on natural treatments. And fortunately, we have some really great options that are very effective. All right, so what are the symptoms of allergies? As I mentioned, classic are nasal congestion, runny nose, sneezing. Sometimes you can have sinus pressure and sinus headaches or headaches in general. Itchy eyes, nose or throat, pretty classic. You can also have allergy-induced asthma, so where it actually affects your lungs. You can also have skin presentation with allergies, and so you can get skin rashes. The most classic is hives, but you can also get things like eczema related to allergies as well, especially food allergies or food sensitivities. So what causes allergy symptoms? So what is actually happening in the body to create the symptoms that we experience when we have allergies? So allergy symptoms are the result of your immune system's overreaction to substances that you've either inhaled or ingested. So it's typically triggered by outdoor allergens like grasses, trees, weeds, sometimes mold, or ingestion of certain foods. And the reaction that occurs in your body involves the release of histamine. And histamine is primarily released from mast cells. And other chemicals are also released called leukotrienes. And it's the release of these chemicals in your body that actually cause the symptoms of allergies. It's not the allergens themselves. It's your immune system's reaction to trying to deal with them. And it gets triggered. So the most common food allergies are peanuts, tree nuts, so nuts in general, wheat, soy, fish, shellfish, citrus, eggs, and milk. And so you can have, these are the most common ones, but you can have an allergy really to any food, an allergy or a sensitivity. And I'll talk about the difference between food allergies and food sensitivities in a little bit. Okay, so what are the root causes of allergies? So research has shown that roughly 70% of your body's immune system is located in the gut. And so allergies and digestive issues, things like gas, bloating, heartburn, constipation, diarrhea, or any other symptoms, abdominal pain, stomach aches, often go hand in hand. So allergies and digestive issues are commonly occur in the same person. And digestive issues and leaky gut syndrome can be caused by lots of different things, but some of the things that can cause it are overuse of antibiotics or NSAIDs, pain medicines, the over-the-counter pain meds, things like ibuprofen. Also, poor diet and stress. These are all things that can cause what we call leaky gut syndrome. Basically, with leaky gut syndrome, what happens is there is a breakdown in the gut barrier, the lining, the mucosal lining inside of the intestines, and it becomes more porous than it should be, and large protein molecules can then pass through the gut barrier that should not be able to pass through, and they pass through into your blood, and your immune system, because those particles are so large, your immune system sees them as foreign to the body and mounts an immune response. And when that immune response is triggered, that is what can lead to symptoms. It can trigger inflammation, digestive issues, allergies, all kinds of things. And so the good news, though, is that we can work on healing leaky gut if that is something that you happen to have. So another factor that can be involved with allergies as well is genetics. And so I see this all the time, that allergies run in families. Yeah, my mom and my dad both had allergies, or all my siblings do. We see that a lot. And so that tendency definitely can be there, traveling through families. And that doesn't necessarily mean we can't treat it, but that genetic tendency is there. So how do you test for allergies? Classic testing is an allergy skin test. Not the most fun thing to experience. I haven't actually experienced it myself, but I know many people and patients that have. It's conducted by an allergy specialist in their office. And it's probably the most accurate way to determine environmental allergies, especially to, grasses, trees, weeds, things like that. But they can test for foods, they can test for animal dander and things like that. So a wide variety of things, dust mites, things like that. We can also do a blood test to evaluate these things. And so you can test for both environmental as well as food allergies and food sensitivities. So what's the difference? So basically, the main difference is the type of antibody that's produced in each response, in each reaction. And so with IgG antibodies, that is what we call an immediate onset hypersensitivity reaction, where you're exposed to something in your environment or you eat a food and you have an immediate reaction. Maybe you have itching in your throat, or your throat's closing up, or you get hives, or something that's pretty immediate after being exposed to it. Whereas an IgG antibody response is what we call a delayed onset hypersensitivity reaction, where you can, let's say, eat a food and 1 or 2 days later have a reaction, and it doesn't present right away. So sometimes that makes it more difficult to kind of figure out which foods you're sensitive to, because it's not an immediate reaction. It happens later. And so it can be a little confusing. But the good news is that we do have testing available to evaluate this in a much more objective way. So, and when you have food allergies and food sensitivities, that can actually worsen your classic allergy symptoms that you have maybe up here, the sneezing, runny nose, congestion can all get worse because you have food sensitivities or allergies. So they are related. People are often surprised by that. So at Living Wellness Medical Center, we offer different testing, but we do offer IgG and IgE food testing. I would say I definitely do food sensitivity testing more commonly, sometimes food allergy, but definitely food sensitivity testing, where we're testing IgG antibodies in response to different foods. And so we have two different panels. One is 96 foods and the other is 184 foods. So the 184 food panel is definitely super comprehensive. It even covers most spices and herbs and spices and things like that, quinoa, things like that, for people that have a more varied diet, I usually recommend that panel over the other one because it does include things like that. So an additional testing option is a test called SeroSlit. And SeroSlit is basically an individually formulated treatment according to your specific allergies. And so you start off with a blood test to evaluate which things you're sensitive to. We will typically do definitely an environmental panel. Sometimes, if indicated, we'll do a food panel. And then based on the results, the company creates individualized drops, and they're used sublingually, which means under the tongue. So it's a sublingual immunotherapy, which can help relieve both seasonal as well as chronic allergies. It can be used for both. And so the concept is similar to allergy shots, but without the needle, without the challenge of having to go to your allergy specialist office and get a shot every week for years. And so this is a very convenient therapy that is painless and can be done in the comfort of your own home. And yet it is individualized the same way that allergy shots are individualized. And so it's basically a daily sublingual drops or spray that you use under your tongue. And like I mentioned, it's individually formulated. And what it's doing is desensitizing your body to the offending allergens that came up positive on your test. So I'm going to touch on, let me go back here for a sec. Okay. I'm going to touch on conventional treatments for allergies. It's just a one pager. I'm going to go through real quick what the different options are. And then I'm going to focus for the rest of the presentation on natural treatments for allergies. So what are the conventional ones? Oral treatments would include things like non-sedating antihistamines, so Claritin, Allegra, Zyrtec, Xyzal, and I find that every person is different in terms of which medication they do better with. Some people also do better with kind of rotating and switching up which medication they use. And so they might use, let's say, Claritin for a while, and then their body starts to adapt. It's not working as well. So they'll switch to Zyrtec, and then that works better for a while, and then kind of switch back. So that can be a nice strategy for some people. And, for some people, these medications work really well, and for other people, they don't work so well, but they are good options, and they are non-sedating, which is nice. So you can take them during the day. We also have sedating antihistamines, so things like Benadryl, and that would, of course, be taken only before bed. Benadryl is definitely a medication you do not want to take long-term, every single day, long-term for years. The main reason is there were some research studies that came out in the last couple of years that basically showed an association between medications like this, Benadryl specifically, and Alzheimer's disease. And so that's obviously something that you don't want. So short-term use is okay, but long-term use is not recommended. Included also as an oral treatment option is leukotriene inhibitors. This would be a medication called Singulair or Montelukast. I don't have that many patients that end up on this medication, whether they're coming in to see me and they're already on it, or maybe I prescribe it. Pretty rare, but it can be effective, especially for people that have really severe allergies or asthma. It can be really helpful. One thing to be aware of with this medication that many people and even doctors sometimes don't realize and make the association is that this particular medication can cause changes, psychiatric changes. And so depression, potentially anxiety, just mood changes, and even suicidality. And so that is definitely something you want to be aware of if you ever were to take this medication, whether it's you or a loved one, somebody you know, and you start to notice changes with their mood. Just know that that is sort of a known possibility with this particular medication. And we should stop it immediately if that happens. Nasal sprays. So there are antihistamines, things like Astelin, Astepro, decongestant sprays like Afrin. These you really got to be careful with because yes, they do work, but then you can have what we call a rebound reaction or rebound congestion where your symptoms actually end up worse than they were originally with that rebound effect. And so, especially with chronic use, you have to be careful of that. For that reason, a lot of people don't really like to use these decongestant sprays unless it's really short term. There are steroid sprays, nasal sprays like Flonase, Nasonex, Rhinocort. These can be helpful in certain situations, especially with really severe symptoms. Once again, hopefully used short term. There are eye drops if you happen to have eye symptoms related to your allergies. And so there are antihistamines like Visine, Opcon A. There are some that include steroids, Flarex or FML. And then there are inhalers for people that maybe have their lungs are affected by the allergies or they have asthma. So there are some that contain corticosteroids like Pulmicort, Flovent. These are anti-inflammatory. And of course, albuterol for any allergy-induced asthma. And that helps to open up the bronchioles, opens up the lungs when you have that tightness with the asthma. And then, of course, allergy shots, right? They've been around for a long time. They are individualized, but, it's definitely an investment of your time and potentially finances if it's not covered by insurance or something like that. But that is a common treatment that's offered in the conventional medical world. All right, here's where we get to the good stuff. So natural treatments for allergies. So these are the different options, and I'm going to go into each one of these in more detail. So natural antihistamines are wonderful. They work really well. Some combination products that I'll talk about. NAC or N-acetylcysteine. Homeopathic treatments, Allergena Zone 6, Histaminum. I'll talk about those. The slit formulas for the seroslit test that I just talked about. Neti pot cannot be underestimated. Very simple, but very effective for allergies. Working on healing gut function, if you happen to have leaky gut or food sensitivities, is very important. And also to avoid any food sensitivities that you might have. So let's talk about the natural antihistamines. So probably my favorite is freeze-dried nettle leaf. This is super effective at helping to stabilize mast cells. Those are the immune cells that release the histamine and cause all of the symptoms that you experience with allergies. So freeze-dried nettles can work really well, especially symptomatically, to help decrease your allergy symptoms. And then quercetin is also a natural antihistamine. Vitamin C, especially with bioflavonoids, they are both natural antihistamines. Bromelain. Bromelain works a little bit differently. It's basically an enzyme that comes from pineapple. And bromelain helps to decrease, it helps to break down the kind of chemicals or intermediary proteins involved with this allergic response, and therefore helps to decrease your symptoms. It's best to be taken between meals for that reason. so that it goes towards sort of breaking down those proteins as opposed to breaking down the food that you're eating if you take it with food. And then there's an herb called butterbur that also is a natural antihistamine. I don't use that all that much. Butterbur also can be really helpful for chronic migraines. Okay, so combination products. I recommend these a lot in my practice. I've used many of them myself as well, and they work very well. So the first one I'm going to talk about is natural dehist. And this also comes in a chewable form for the little kiddos. My daughter has taken this and it's helped her a lot. And then, so this contains, so the freeze-dried nettles, it has quercetin, vitamin C, it has some bromelain and some NAC. And I'll talk about NAC in a little bit and kind of the benefits of NAC. Seasonal Clear is another one of my favorites. Has freeze-dried nettles, bioflavonoids, echinacea, bromelain. It has some enzymes in it that, similar to bromelain, help to break down those sort of proteins that are involved in that allergic response and decreases your symptoms as a result. And therefore, once again, Seasonal Clear is best taken between meals. It'll still help you if you take it with food, but it works a little bit better taken between meals. And then there's another product called BCQ that has bromelain and boswellia. That's what the B stands for. Curcumin, also known as turmeric. That curcumin is the active component in turmeric. That's what the C stands for. And quercetin, that's what the Q stands for. So this is also a really nice combination product that can be helpful for allergies. I also recommend this supplement a lot for pain, any kind of both acute as well as chronic pain, and it works very well. There's also a supplement called Sinatrol. This is more specific for sinus, people that have sinus issues or have a tendency to get a lot of sinus infections. And this contains NAC. It has a variety of different herbs that help with immune regulation and also to decrease inflammation. It has some bromelain in it, as well as turmeric, which is anti-inflammatory. Okay, I'm going to talk about NAC. So NAC, also called N-acetylcysteine, is an amino acid. And it has a lot of benefits in the body, but one of the main things that it does in relation to allergies is that it helps to thin mucus. So it's especially indicated for people that have just a lot of mucus. It's really thick, maybe it's thick, yellow, hard time blowing it out or coughing it up, getting it out of your body. And so NAC, similar to Mucinex, which is a medication, it helps to thin the mucus and drain it out of your body. And this helps not only to alleviate symptoms, because you can have extra, pressure in your sinuses with all that mucus hanging out there, but it also helps to prevent infections, because bacteria love warm, moist environments. That's where they thrive. That's where they can grow. And that is mucus hanging out in your sinuses or your lungs. So you want to get that mucus out of there. I mean, the mucus in and of itself, it's a protective mechanism that your body is producing to try to deal with, whatever's going on, whether it's an infection or allergies or whatever, but it's not good when it sort of builds up and just sits there. So you want to get it out of your body. NAC also strengthens the lungs. And so I love to recommend this both for allergies, asthma, as well as, if you get sick with a cold or flu or COVID or anything like that. This really can be very helpful for like a cough, that sort of thing. It's also a powerful antioxidant. So that's a wonderful health benefit just in general. And then it helps also promote detoxification in the liver. So I love NAC. It has so many benefits in your body. All right, homeopathic treatments. So there are two that I've listed here. There are definitely more than that you can use in addition to these. Lots of different homeopathic remedies that are helpful for allergies, and that's very much individualized as well, according to what your symptoms are. Things like Allium cepa, for example, But I'm just going to talk about these today. Allergena Zone 6. This is basically a sublingual immunotherapy that helps to desensitize your body to the common environmental allergens that you might be exposed to, especially during allergy season. And so it's homeopathic. So it's their homeopathic preparations that made from about 75 grasses, trees, and weeds. And so there's a different preparation for each area of the country. So the one, of course, that I prescribe the most is the Zone 6, because that covers Arizona. It basically covers the Four Corners area. So Arizona, Utah, Colorado, and New Mexico. So, and it's not necessarily individualized the way that the seroslit test is, but because there are 75 plus different grasses, trees, and weeds in the preparation, you can safely assume that it's going to cover, the things that you're sensitive or allergic to. So, and I've had pretty good success using this with patients, and so it's generally recommend. So you put it under your tongue, the drops, and it's generally recommended anywhere from 10 to 15 drops under the tongue 3 times a day. So it is a little bit of a commitment, and it does take some time to desensitize. And I even sometimes recommend starting this treatment even before allergy season starts, so that by the time it hits, you're already kind of desensitized, or at least you've started that process. Histaminum is a homeopathic remedy made from histamine. And for anyone that's not familiar with homeopathic medicines, they're very dilute medicines that come on little sugar pellets that you dissolve under your tongue. They're very safe, but effective. You can give them to pregnant women, babies, so they're very safe. And they actually have done research studies specifically on homeopathic histaminum and showed it to be helpful in treating symptoms of allergies. So there is some research behind that particular remedy. So then there are slit formulas. Like I mentioned, they're sublingual. It's convenient oral treatment that you can do at home rather than a shot. It can help to treat asthma and allergies. It's individualized according to your lab results. And basically, it's delivering a very precise dose of the substances that trigger the allergic reactions. And it's stimulating your immune system, but not enough to cause a full-blown allergic reaction. It's just sort of priming your immune system so that it doesn't have such an over-exaggerated reaction when it comes in contact with those actual allergens. The dose of allergens is gradually increased over time. So you start low and slow, and then gradually increase it. And this helps the body's immune system to sort of build up a tolerance to the allergens. And they're sublingual drops or a spray, and they're effective for adults and children with mild to moderate allergies. Neti pot. So neti pot, probably most people have heard of this or used one. They're fantastic. I mean, they really help. It's such a simple concept, but essentially, you're helping to clear out particulates from your nasal passages and your sinuses, things that, pollen and things like that, or dust that would trigger that allergic response. And you're just clearing it out every day. I usually recommend every morning, every night. There are different types of neti pots. There's ones that look like little teapots. There's little squeeze bottles, different ones. Everyone has a different preference. You just add sea salt to warm water. It should be filtered water. And you kind of run that through your nasal passages and sinuses, and it just clears everything out. Some people like to add other ingredients. You can add a little iodine, oil of oregano, allicin, which is a garlic extract. Especially if you have an infection or something like that, it can be really helpful. Of course, you want to work on healing your gut function. Probiotics are my favorite, very, very important, and beneficial bacteria regulate your digestive system and support the normal functioning of your immune system, which is, of course, really important when it comes to allergies. I love to use gut repair powders, especially for people that do have food sensitivities. That's a very important part of the recovery, in addition to avoiding those foods for a period of time. So might contain things like glutamine and aloe vera, licorice, and helps to heal up that leaky gut. Sometimes I'll use glutamine on its own, and that is, glutamine is an amino acid. It's the main fuel source for the cells in the intestinal lining, so it helps them to heal, it decreases inflammation, works really well for gut issues. And then something called butyric acid. This is a short-chain fatty acid that's produced in the gut when beneficial bacteria ferment fiber. So you got to have the beneficial bacteria, you got to be eating enough fiber, and that creates these short-chain fatty acids in the intestines that help to heal leaky gut. So you can also supplement with butyric acid, and sometimes I will do that as well, in addition to probiotics, adequate fiber. You, of course, want to avoid food sensitivities because those are only going to make your allergy symptoms worse, and they're trigger your allergies, inflammation, and things like that. This is, as I mentioned, an IgG antibody test that you can do. I generally recommend avoiding the 2+ and 3+ foods. Those are the moderate and severe reaction foods for at least 3 months. And also, of course, during that period of avoidance, monitoring how you feel. Are your symptoms better? Is your energy better? Is your digestion better? And then you want to, after 3 months, slowly reintroduce one food at a time, maybe starting with your favorite food, whatever food you miss the most. Start with that and really eat lots of that food for, usually maybe every 3 days, once a week if you want. Depends on how many things you were sensitive to, how slowly you want to reintroduce. And during that reintroduction phase, you're really wanting to pay attention to any symptoms that you experience. And if you do experience symptoms after 3 months, it means you need to avoid it longer and continue to work on gut function and healing up the leaky gut. And then the foods that are 1+, that are mild reactions, I don't necessarily recommend avoiding those foods altogether unless you have an obvious reaction when you eat those foods. I just recommend minimizing and rotating those foods so maybe once or twice a week, so you're not eating them all the time. So in conclusion, allergies are very common. Probably most people have allergies themselves or know somebody that does. Super common. Testing can help to determine possible causes and what the best treatments would be for you. There are many conventional as well as natural treatments for allergies that are very effective and sometimes used in combination, both the natural treatments used in combination, but sometimes, maybe you're taking a medication and a natural treatment, and that's what really helps you. So lots of different options that way. Natural treatments, fortunately, are very effective and without the side effects, which of course is always nice. So, and then testing and treatment for allergies is very individualized as well. And your doctor can sort of determine based on your testing and talking with you what the best treatments would be for you. All right, so here's my information. Thank you so much for joining me, and I hope that you learned a little something during this webinar. If you have any questions, please post them in the chat, and I will be happy to answer any questions that you have. So far, no questions. Okay. All right. Well, if you do have any questions, be in touch with us. This is my contact information. All the docs here at Living Wellness Medical Center, of course, treat allergies. And so feel free to consult with one of us if you're struggling with allergies or if you know someone that is. And stay in touch. Visit our website, livingwellnessmedicalcenter.com. And we'd love to hear from you and stay in touch. And we do offer these webinars once a month, so tune in next month for the next one. And thank you so much for your time today. All right, thanks. Bye-bye.